Good evening, ladies and gentlemen. Welcome to another episode of Health Talk Show. Today here, I am Polly Kormokar with you, and with me, we have a distinguished guest from Bangkok Hospital. Let me introduce to the team first. At my right, today we have Dr. Krai Hengrusame, Director of Bangkok Heart Hospital. At my left, Dr. Parmios Rubensakulras, Cardiovascular and Thoracic Surgery Department. And at his left, Dr. Wichai Zirarochun Kun, Interventional Cardiologist. Welcome to our show, everyone. So we'll start with Dr. Krai. How are you, sir?
Very well.
Is this your first time in Bangladesh?
No, it's second time. I have been in Bangladesh once in 2022.
Oh, it's been 2 years.
2 years ago. Yes.
Okay. How are you doing here? How was feeling to staying here?
It's a very warm welcome for the Bangladesh people and for the warm welcome of everything.
So, sir, as you're the director of Bangkok Heart Hospital, I would like to ask you that Bangkok Heart Hospital already earned a lot of trust from Bangladesh people. So, what are your updated facilities from your hospital for the people and for any kind of patients at your hospital?
Yes, for the update facility, right now we have the genetic test for cardiac disease such as coronary heart disease, atrial fibrillation, and sudden cardiac death. That's update. And we have the transcatheter intervention for the congenital heart disease, for the valvula. Right now we have to perform the procedure percutaneously, not open heart.
Okay.
That is a very update for the treatment and for the investigation.
So, what do you think? That why Bangladesh people are so prone to go at your hospital?
Yes,
why it's so
because,
famous there?
Because we have many cardiologists in the subspecialty field. Every field, like as an imaging specialist, like the coronary interventionist, like the cardiac surgeon, and all the cardiac nurse that can take care. And we have the multidisciplinary team, like the pharmacist, like the PMR, like the dietitian to take care of the people with the heart disease.
Okay. I'm sure you have a lot of patients from Bangladesh. Yes. So, what are the common types of diseases, heart diseases, you have noticed from Bangladeshi patients?
Yeah, right in another country, in Thailand, USA, the most common is about the coronary heart disease.
Coronary heart disease.
Yes,
Okay.
coronary heart disease.
And any other, like?
Right, the second one is about hypertension and diabetes. That is from statistics from our hospital, from Bangladesh patients.
You have any suggestion for the preventions of those diseases or anything?
Yes, that is very important for the prevention. I would like to set in the A, B, C, D, E, and S.
Okay.
A is about the air pollution. You must avoid air pollution, PM 2.5,
Okay.
and not drink too much alcohol.
Okay, that's the first. Okay.
B is about the body weight control, BMI control, and blood pressure control if you have hypertension. C is about the cigarette smoking. You must stop cigarette smoking. You must control cholesterol level. D is about the diet. You must have the healthy diet and control the diabetes. And you have the drug. When the patient with the heart disease, you must take regular medications to prevent the complications. E is about exercise. You must take exercise about 30 or about 150 minutes per week. And last one is the S. S, you must stop about stress.
Okay.
Stress management.
Okay.
So smile and you can have the health heart. Thank you.
So it's precisely the lifestyle management.
Yeah, lifestyle is very important because lifestyle has a payload about 30%. You have the good lifestyle, you have the heart health, healthy heart, you can cut off the disease about 30% if you have good lifestyle.
Okay, that's very beneficial for our audience, must. So now I would like to come Dr. Parmios. So Dr. Parmios, welcome to Bangladesh. How are you?
I'm fine, thank you. Thank you for having me.
Thank you. Have you visited here before or this is your first time?
This is my first time in Dhaka.
Oh, then you were specially welcome to our show and to our country. So Dr. Parmios, as you were specialized cardiovascular and thoracic surgery is a vast area as per as I know. Could you please share to our audience that what are the most common heart surgery?
Okay. I like to show this. So, most common cardiac surgery performed is a coronary artery bypass grafting and heart valve repair and replacement. Okay, and I like to show you this is a heart model. And when you have coronary heart disease, you have this artery blockage. Okay, so this is the left side, and this is the right side of the heart. Okay, this is on surface of the heart. You have artery, and then we put new artery
Here.
bypass the blockage. That we call bypass surgery. Okay, and the second one that we do is valve surgery. So we can open the heart and we do replacement the heart valve. Okay, with some help with the heart lung machine and to stop the heart. Okay.
So, since you have many experience in this field, especially with Bangladeshi peoples and around all over peoples, all over patients, could you please share us other common surgical procedure you have noticed among all over the world?
Okay, and the other operation I specialize on is carotid endarterectomy.
Okay,
So-
what is this? What is the procedure
So that
actually?
the artery from the heart like this, okay, one branches is go to the brain, okay, the other one go to the other side. So we can do the blockage. We remove the plaque from the artery and we just repair it to prevent the stroke. So if you don't do, then you will have a chance that you have stroke.
Okay.
And if you have stroke before, then we can do this surgery to prevent the second stroke.
It can
so
be
they
the
can live
prevention.
better. So it can prevent both primary prevention and secondary
Secondary.
prevention.
If even the patient already faced the stroke, then also he can do this, right?
Yes, because if he not fixing this problem, then it can happen again, the stroke.
Thank you. Dr. Vijay, welcome to Bangladesh. How are you today?
I'm fine. And this is my first time in Bangladesh.
Oh,
Very
okay.
exciting.
Okay, have you visited any other place, rather this place or any other like hospitals or somewhere?
I have experience in Japan and Cambodia before.
So, as we know that you are an interventional cardiologist, usually what are the common types you have noticed among Bangladeshi patients?
Most of them come to see me with the symptom of like a chest discomfort and to demonstrate is any like a coronary disease or not. So when I saw this patient, I do some tests to identify if he has a heart disease or not, and then we plan to do specific procedure to treat them if he has a coronary disease.
So, what are the common procedure? Tell us some about you have performed already for Bangladeshi patients. Have you?
Because I'm interventional cardiologist, my job is do the angiogram and see is there any block of the artery or not. If the anatomy is suitable to do the balloon stent, then we do it to prevent the heart attack.
Okay. So I have a little question. Maybe this is personal kind of, but it's experimental for you. As my father is recently diagnosed heart disease, the doctor said he maybe had some problem, and he went for two doctors. So one said you need to do ETT, and the other said you need to do angiogram. So what he should follow, you think?
Usually it depends on first of a symptom, and the second one is the test. Usually we start with the take the physical history and do the physical exam. And if the possibility of the coronary artery disease is more, then we start to do the test like a ETT. If the ETT is definitely show abnormal, you can go to the cath lab, do the angiogram. But in some patient cannot do the ATT because of some maybe related to his physical activity. So maybe do the like a CT angiogram first.
First.
Yes.
Okay, that is very helpful personally for me. Thank you so much. So thanks all of you. Then now I have the part here to advise something from all of you for our audience. So first you can start, sir.
Yeah, right. Because heart disease is a dangerous one, and it causes fatal and the number one of killer for the people in the world. So you must take a lifestyle modification for live longer and live better with the quality of life. So please modify your lifestyle. And if you have the disease, please control your disease like diabetes, hypertension, dyslipidemia, and stop cigarette smoking. That's all.
Okay.
Thank you.
Thank you. Sir, have you any advice for our audience or anything you want to say them?
Okay, thank you. And I would like to ask advice to all of you to take care of your heart and your brain, okay? So maybe you should go to Bangkok Heart Hospital because we specialize in doing bypass surgery and we do it differently. We do off-pump bypass. We not need heart lung machine. We not need to stop the heart. We just make this still and then we can do perfect anastomosis and we don't need to do with the chemical to stop the heart. And that will help the patient go back to work sooner and reduce the complication, the stroke, the kidney, and the lung. I think that good to do and to go to Bangkok Heart Hospital. And also the stroke. If you don't have stroke before, you should go and check your carotid artery, I mean the carotid both sides, with the ultrasound, or you have a warning sign, like you have imbalance. You cannot walk. Suddenly, you can have the blindness to one eye. You have face drooping, and you have speech problem. Then it might be a warning sign of the stroke. Okay? So they should go and check everything from the brain to the heart because something can happen from the heart, cause the stroke. Something happen to the artery, cause the stroke. So if they go to do it sooner, then they can prevent the stroke, and that is very devastating problem.
Scenario,
okay.
In this
I
case,
think
Bangkok.
the early treatment and diagnosis is very good to do it.
Thank you so much. In this case, Bangkok Heart Hospital can be a must-go-to place for our audience and for the patients of heart disease. So, Dr. Vijay, have any advice for our audience?
So, because of I think the prevention is the best. So, in this session, as Dr. Kenkai said, I think you need to modify your lifestyle first and control your risk factor. Anyway, if you have already have the disease, it's not too late to change your lifestyle again. Continue your medication, control your risk factor, and this can cut the chance of to happen the heart attack again.
Okay.
May I add some information?
Of course.
Because right now we have the treatment by transcatheter. If you have the hole in the heart, we can cross with the special device, transcutaneously, not the open heart. Right, the S is right. We have performed many cases, and the result is very good, about 100% success rate.
It's also very helpful for our audience that who doesn't want to do this bypass or any surgery.
It's a hole in the heart is congenital. When you have the hole in the heart, it can cause the heart to enlargement and heart failure. And some people are present with a stroke. There's a small hole, and we have many cases we can close it. And for the valve, we have right now a transcatheter to replace the valve and to repair the valve, not operation.
Absolutely amazing.
Yeah, this is the latest technology that we have right now. Okay, thank you.
Okay, thank you so much. Thank you all of you again for your valuable time and for your valuable suggestions, advice for our audience. So we're almost at the end of our show. So our audience will be benefited for this episode must, and they will visit to Bangkok Heart Hospital as per their needs, as per their demand, I hope. Audience, stay happy, stay healthy. Till the next show, goodbye.